Hey there, doc. Let's talk about something you do multiple times a day but probably don't think twice about. Writing a prescription. Sounds simple, right? Well, tell that to the doctors who ended up in court over prescription errors. I know, it's just a piece of paper. But in the eyes of the law, it's a legal contract. And if it's not done right, it could cost you your reputation, your license, or worse, a hefty lawsuit. So let's dive into how to write a legally bulletproof prescription. Yes, I know. Between seeing patients and handling emergencies, who has time to obsess over a prescription? But trust me, one small mistake and you're defending yourself in court. Let's talk about why this matters. In the landmark case of Jacob Matthew v. State of Punjab in 2005, the Supreme Court ruled that doctors can only be held criminally liable if their actions show gross negligence and not just an error in judgment. But a sloppy prescription? That can easily fall under gross negligence. Another case, Poonam Verma v. Ashwin Patel in 1996, involved a homeopathic doctor who prescribed allopathic medicine. The patient died, and the doctor was held liable. The lesson? A prescription isn't just a note, it's a legal document, and if you mess it up, you're responsible. So, how do you write a legally sound prescription? Think of your prescription like a contract. It needs to be crystal clear, with no room for misinterpretation. Here's your checklist. First, check the patient details. Name, age, and gender, because two different people can have the same name. Check the date. An undated prescription can be misused or forged. As per NMC guideline, you should prescribe generics whenever possible. 500 milligrams, tablet, syrup. Be clear. Instead of 1 tab BDPC, write take 1 tablet twice daily after meals. Avoid as needed. Specify the exact number of days. Mention the details of the doctor. The name, qualifications, and registration number are mandatory under the Indian Medical Council Act, 1956. And signature. Yes, even digital prescriptions need it. Now, let's talk about common prescription mistakes that can get you in trouble. Doctors' handwriting is the stuff of legends. But if a pharmacist misreads paracetamol as phenobarbital, guess who's getting sued? You. The fix? Write in capital letters or use electronic prescriptions. Avoid ambiguous abbreviations. You write OD for once daily, but the patient takes it as only in day. Yikes. Just spell it out. Are you prescribing non-OTC via telemedicine? Under Telemedicine Guidelines, 2023, Schedule X drugs can't be prescribed online. Beware of off-label use without consent. If you're prescribing a drug for an unapproved use, get a written consent. The Dr. Kunal Saha v. Amri Hospital 2013 case led to one of India's highest medico-legal compensations because of lack of proper consent. Don't make that mistake. Remember the 2023 chaos when the NMC mandated generic prescriptions? Doctors protested, and the rule was put on hold. Now in 2025, the NMC encourages generics but doesn't legally mandate them. If you prescribe branded drugs, note your reason in the patient's file to stay safe. At the end of the day, your prescription is more than medical advice. It's a legal document. So let's make sure it's solid. Don't forget to like, share, and subscribe for more medico-legal survival tips.